obtaining vital signs. So vital signs are measurement of the body's most basic functions. It includes body temperature, pulse rate, respiration rate, and the blood pressure in which taken or recorded. So obtaining vital signs are useful in tracking, detecting, and monitoring medical problems. So the paraphernalia needed in these procedures are digital thermometer and the cotton for taking the body temperature, stethoscope, and the sphygmomanometer for taking the blood pressure, and of course a watch for taking the pulse rate and the respiration rate, and an alcohol for disinfections and to avoid contamination. Now let's proceed on taking the body temperature. Temperature is very important because it reflects the balance between the heat production and the heat loss of the body. There are a few sites in taking this or obtaining the measurements of body temperature. So it can be orally, axilla or underarm, rectal, temporal or forehead, and tympanic membrane or eardrum. Now I am taking my patient's body temperature through her axilla. Prior to the conduct of this procedure, we must perform the hand hygiene, of course, then prepare the equipment needed, which is the thermometer, cotton, and an alcohol. So now, let us start by introducing myself to my patient and explain to her what I am going to do. So, good morning, ma'am. I am Jean Rafael, your student nurse for today. And I am going to take your body temperature through your axilla. So, may I see your wrist? Then, please state your complete name.
My name is Roma Bisayna.
Okay. And your birth date?
July 13, 1991.
Okay, thank you very much, ma'am. So, now let's get the thermometer. Wipe it from bulb to stem in a firm twisting motion. Then shake it so that the mercury will get into lowest markings. Now, let's assist the patients into supine position. Okay. Now, raise the patient's arm. Then, check if the area is wet, and put the thermometer at the center area of the axilla. Then arms down. So now let's wait until 5 to 10 minutes or until it's beat, so that we will know the correct measurement of the temperature. Okay, So now, let's remove the thermometer. So read the temperature in eye level. Inform the patient for her temperature. So ma'am, your body temperature is 35.8 degrees Celsius, which is within the normal rate. So now, let's wipe the thermometer from stem to bulb in a circular motion. Okay? Wash it after, then dry and shape it, then put it on the container. Assist the patient again. So, perform the hand hygiene, of course, then and document the data gathered into the patient's TTE sheet. Thank you. Now, I am going to proceed on taking my patient's pulse side. So, pulse is the expansion of the arterial walls occurring with each ventricular contraction. So, the purpose of this procedure is to count the number of the heartbeat per minute and of course to obtain information regarding the condition of the heart action and the patient's general condition. So in order for me to measure it, I'm gonna need to do palpating or palpation of on the pulse side of the patient through her, which could be through her temporal, carotid, apical, brachial, radial, femoral, popliteal, tibial, and her dorsalis pedis. So today I am going to be palpating her radial pulse, because it is the most easiest and most accessible pulse site. So prior to the conduct of the procedure, I am going to introduce myself to my patient and explain to her what the procedure is, and of course ensure the patient's comfort and perform hand hygiene. So now, good morning ma'am. I am Jean Rafael, your student nurse for today, and I am going to measure your pulse rate. Is that okay with you ma'am? And may I see your hand, please? Please state your name, complete name please. And of course your birth date.
July 13.
Okay, thank you very much. Now I'm going to assess your pulse site. So rest arms alongside of your body with the wrist extended and hands downward. So I'm gonna locate my patient's pulse rate by my 2 fingers, and I'm gonna trace it from the thumb into this area with the thumb at the back of the wrist, because remember that the thumb has actually a pulse in it. So if we use our thumb, we're gonna be confused on taking the accurate pulse rate. So yeah. So aside from taking the beat per minute, I'm also gonna check the strength of her pulse, graded from 0 to 3 plus scale. So 0 means pulse absence, 1 plus means weak, 2 plus means normal, and 3 plus means pounding. I'm also gonna check its rhythm if it's regular or irregular. Now that I have found her radial pulse, I'm gonna start and apply enough pressure. So I'm gonna feel the pulse and not too hard, not too light. And using my watch, I'm gonna start to count the beat per minute. So ma'am, your pulse rate is 73 beats per minute, which is within the normal limit. Okay. So if the pulse is abnormal, repeat counting to determine accurately its rate, quality, and its rhythm. And also we have to remember that we have to report to our physician for any significant changes in the pulse rate. And then after the procedure, let's perform again the hand hygiene, then record the result of the patient's TTE into the patient's TTE sheet. Now let's continue on taking respiration rate. Respiration is the process by which oxygen and carbon dioxide are interchanged. The purpose of this procedure is to obtain respiration rate per minute and also to obtain information of the patient's respiratory status and general condition. In this procedure, we have special considerations that we have to remember. So first, note the rate, depth, character, or respiration. Second, while counting, observe the patients closely if there is any sign of abnormalities like color or chest movement, and etc. Third, take care that the patient will not made aware that his or her respiration is being counted. Alright? Prior to the conduct of the procedure, I am going to perform hand hygiene. Then ensure the patient's comfort and at ease. Now let's start by introducing myself to my patient and explain to her the procedure. So ma'am, I'm Engineer Rafael and I'm your student nurse for today. So I will be counting your respiration rate, and I just want you to be at ease and be relaxed, alright? So now, So hold the wrist of the patient as if that you were taking her pulse. Then note the rise and fall of his or her chest. And using watch, count the number of breath for 1 full minute, alright? Respiration rate, ma'am. So after the procedure, do the hand hygiene, of course. Then state the patient's respiration rate. So ma'am, your respiration rate is 17 breaths per minute, and which is within the normal limit. So then the result is record the result of the patient's respiration rate to her TTE sheet. Now I will be taking my patient's blood pressure. So it is a pressure exerted on the wall of the arteries when the left ventricle of the heart pushes the blood into the aorta. So the purpose of this procedure is to determine vascular resistance to blood flow. Now, prior to the conduct of the procedure, we have to prepare the equipment needed in this procedure, and it is the sphygmomanometer, of course, and the stethoscope, also the pen and the paper for recording. Then we have to perform the hand hygiene, of course. Now let's start introducing myself to my patient and explain to her the procedure, of course. Ma'am, my name is Rafael, and I am your student nurse. Now I am taking your blood pressure. So then please state your complete name. Your birthday, please.
July 13, 1992.
Okay, thank you very much. Also, so place the client into a comfortable position. Then place the cuff around her arm at the center, at least 1 to 2 inches above the brachial artery. wrap around the arm. Compress the valve to inflate cuff. Release the cuff slowly and listen to the first sound. And continue releasing the air slowly. Okay. I heard the last sound. That was diastolic. The first sound is the systolic. Now deflate the cuff rapidly and completely. So, 110/70.
Ano yung gabi?
Clean and store the equipment. Then perform the hand hygiene. And record the result. So 110 over